Thalassemia is a genetically determined heterogeneous group of commonest monogenic disorder in which the rate of synthesis of one or more types of hemoglobin polypeptide chain is decreased. So there are two types of thalassemia, mainly alpha thalassemia and beta thalassemia. In beta thalassemia, there is a failure to synthesize beta chain, which is more common. There is excess alpha chain production that damages the red cell precursor and red cells. So here the failure to synthesize beta chain is occurring, and there is an excess of alpha chain production here. There are many homozygous and heterozygous and major and minor forms of the disease. In beta thalassemia major, there are beta thalassemia major and beta thalassemia minor. In beta thalassemia major, anemia develops in first few months of life and becomes progressively severe. There is splenomegaly, hepatomegaly, and skeletal deformities are commonly seen in beta thalassemia. So the anemia is usually microcytic hypochromic here. All forms and combinations are not uncommon. This is the picture showing peripheral blood smear in beta thalassemia major. You can see the presence of cystocyte. You can see the presence of microcytosis here, the microcytes here, and you can see the target cell. You can see the cystocyte here. You can see the microcytosis happening here. Microcytosis, the target cells are here. This is the picture showing the peripheral smear in beta thalassemia major. Coming to the second form of thalassemia, alpha thalassemia. Anemia of alpha thalassemia. Alpha thalassemia means there is a failure to synthesize alpha chain. So the anemia of alpha thalassemia is more hemolytic than dyserythropoietic. It is more hemolytic form. Thalassemias are diagnosed by hemoglobin electrophoresis. It can be demonstration of HbH inclusions can be done. That is, in the absence of sufficient alpha chain, excess of beta or gamma chains aggregate to form HbH. Study of rate of globin chain synthesis, alkali denaturation test, and acid elution test. So the two forms of thalassemia is beta and alpha thalassemia. Beta thalassemia, you can see there is a failure to synthesize the beta chain. There is an excess of alpha chain in beta thalassemia, whereas in alpha thalassemia the failure to synthesize alpha chain is seen, and it is more hemolytic, and the thalassemias can be diagnosed. It can be diagnosed by hemoglobin electrophoresis. The demonstration of HbH inclusions can be done. The study of rate of globin chain synthesis, alkali denaturation test, and acid elution test are the other tests you can find out the diagnosis of thalassemia.